And so we're here today to confront some of our successes, which are new interests, new funding, new initiatives in food, and to look at what are some of the problems that come about when multiple new initiatives are being launched at the same time, often without coordination and communication among those initiatives. And we're also looking not just to lament that problem, but to figure out what to do about it. What are the strategies for finding synergy among these multiple initiatives and seeing how we can better coordinate them to achieve targeted goals? Because wouldn't it be a shame if 5 years from now we couldn't point to some very significant successes in reducing food insecurity, improving the working conditions of food workers, reducing diet-related disease? You know, wouldn't it be a waste not to have used all those resources to make things better?
It's just a robust, just so many people, so many different organizations working in this space. So it's just really hard to know who's doing what at any given time. Toward the successful element, to the successful piece of that, is that what we've really been trying to do is kind of build coalitions, and I think that has worked, to a certain extent. And so at Restoration, again, we manage a borough-wide coalition on behalf of the health department. We have counterpart coalitions in each of the 5 boroughs, and the coalition that we manage has 100 members as part of the coalition. And similarly, for the coalition that we managed for the Kellogg, it was focused on Central Brooklyn. And I think because of these coalitions, we've really been able to kind of find synergies and devise strategies together, as well as complement each other in very specific tangible ways. I mean, I think one of the things that we've been able to do is been able to kind of help to increase capacity of some of the partners at the table. So we have Cypress Hills, NEPCO, which is funded by LIST, because we have funders that have technical assistance and national convenings. We've been able to bring our partner from Cypress Hills, our partners from NEPCO to the table, our partner from LIST to this convening, and as a result, I think they got a lot out of it. And one example is in the case of NEPCO, which is funded by LISC and Illumination Fund. They started a very focused initiative that was around youth empowerment and food policy. And they got that initiative, from the Kellogg, convening that we brought them to. So I think that is one example, and I think as we've had to navigate the different funder requirements, we've also had to lock horns with them and also kind of push them to see our point of view. And so what we've done moving forward is really try to synchronize and coalesce our work plans so that they complement the various funding agendas as opposed to operate in silos. So for example, one of the things that we're focusing on is a farm to early care strategy, or working with the early care population with Head Start operators to introduce farm fresh food to Head Start partners around the borough as well as in Central Brooklyn.
Oh my God, we're doing that too. But are we doing it together?
I would assume so.
Okay.
They're funding us, right? I would assume so, right? I would assume so.
So I wanted to just say a couple of things before I tell you how, one of the million examples of how we bumped heads. One is that people all over the city are doing great things about food, half of which we don't know, even though we try to keep a laundry list. And Diana and I can tell you that we go back and forth trying to map out just 2 zip codes in Harlem, and we can't even find all the things that are happening. The second thing is that funders really direct our work, as Tracy was saying. So it may be that LISC, for instance, has a special talent in one thing that the health department doesn't, but we both have funding to do similar things as well as different things. And so we bump heads a lot, like, isn't there an economies of scale, which I think is what Nick is after. So the last thing about all of us is that because programming is so expensive, we tend to direct our programming in the most underserved areas. So that's another area where we kind of bump up against each other, whether it's the South Bronx or Brooklyn. Staten Island gets the poor side of all of our work, but we're trying even there. I think that as much as we're really trying to bring things together, we still have some challenges about how to keep that as we grow and as we finish one initiative, how much more there is to do. The second, little piece that I just want to tell you, because Bed-Stuy restoration is fabulous in all kinds of ways, but another way that we've worked together is that many of us have worked in bodegas, and I'm not going to tell them what year, but, and many of us have worked in bodegas in ways that could drive you crazy because we're all doing the same thing and we're all looking for money and we're all looking for handouts that are different from each other, yet we're all doing the same thing. Bed-Stuy restoration had so much food stuff going on and was so in tune with their whole area that we actually only needed one person to go in there and do the work of 7 people in other areas that didn't have that kind of cohesive food policy work going on already. So it was a way of us kind of connecting with a group that already had boots on the ground, and we could do a lot more with a lot less, and so that was really helpful.
So when we were doing, our first year was 2013, and it was a planning year. So we spent a lot of time doing surveys, focus groups with residents, asset mapping, figuring out citywide partners, local partners. And what I realized is that there's so many people doing so many different things in all of these neighborhoods. And our goal was really to build partnerships so that we could utilize the community center that New Settlement Apartments has as a health hub for a farm share to come in and integrate food stamps and cooking nutrition classes and things like that. But when you start to try to put all those dots together, you realize, as Kathy was saying, that sometimes people have grants where they can't go into certain catchment areas. They're focusing on these different areas, so it kind of limits the amount of partnerships you can create. Then in some cases, you realize that you're doing so much work in some neighborhoods, as Kathy was mentioning, and in other neighborhoods there's gaps, there's no work happening. So, is that a good model? We talk about that a lot. And then there's a fatigue, I think, on the city level. So there's all these different initiatives going on, and we're trying to heighten our work, lessons learned, and talk to the mayor's office, the health department, whoever it might be. And
we have no money.
But also, not even just on the money side, but partnership side, sharing resources, partnering together, collaborating. And I know Barbara Turk from the mayor's office, we've met with her a lot, and so has groups like City Harvest and other folks that are also doing comprehensive work. And it's hard for all of us to collaborate and get on the same page and go to the mayor's office, for instance, with the same messaging on what we need, where are the gaps in policy, how could we all collaborate to heighten our work. The last thing I would mention is, with all these different multiple things going on in the neighborhoods, one kind of anecdote is that in each of our neighborhoods we were trying to create a healthy resource map and guide of everything that was going on in the neighborhood, and there's so many things going on that it was hard. It keeps on changing. There's another dot for another farmer's market. There's this exercise going on here. So it's hard to get clear on the goals and the objectives of your program when there's so many other things going on that can kind of, you can start to kind of, I guess, dissipate and kind of lose sight of what your goal was to begin with. And the other thing is on the evaluation side. This also will turn into kind of a success later, but there's a lot of groups that are doing evaluation, but in some cases with food retail, for instance, we're asking different questions. We're not asking the same questions. So it would be really interesting if we could come up with some similar questions that we could ask across a LISC, a City Harvest, a Department of Health. So we could think about collective impact, first of all, but also think about where are the gaps, who are we not hitting, what can we learn about shopping behavior, and really try to affect policy. So if we could come together, I think there would be greater impact, and we could heighten our work to create system-wide changes.
It's a huge
huge amount of funding that just got focused on our community and in different directions. So, all of a sudden there's a community health worker initiative and 5 NYCHA establishments. There's the Pitch grant, the BEAT grant, not just Department of Health though. There's also Mount Sinai getting grants. There's Hunter College now, we're doing a lot of work in East Harlem. And it happens to be the year that I was doing a lot of this landscape analysis work. So I was really trying to get a handle of it all. And what happened was a number of us came together and said, we're trying to establish a vision for what this community can accomplish in 5 to 10 years with food goals. And that's part of what I do at the center is trying to get everyone together for this campaign for healthy food in East Harlem to vision together. So we said, what are the current groups, coalitions that are already existing? What are they doing? And so, there are a number of them in East Harlem. There's a community health committee. There's a consortium that's focused on human services. There's the North of 96th Street Coalition. It can go on. And it just so happens that not any one of those groups was specifically looking at food. They looked at health, mental health issues, health care, but no one was focusing on food, and so we found a gap. And so the groups came together, and it was the center, along with Mount Sinai and SCAN New York, which is a multi-service agency in East Harlem. We came together and said, why don't we create something called the Healthy Food for Upper Manhattan Group. This was something that was going to try to bring everyone together. Let's just sit down, let's have lunch, let's not even make it a traditional meeting, let's just eat, let's talk about what's happening, and let's get a local vendor to supply the food, and let's just talk about all the different funding that's coming in, let's talk about the priorities, let's talk about where we can come together and try to have some collective impact. And that's the model that we're trying to look at in East Harlem is really shifting away from having this isolated impact through our separate groups, but really trying to come together and say, where can we have these shared agenda items? There's a few conditions in order to really have collective impact. I'll just mention a few. So having a common agenda is important, but also having shared measurement systems. So I think someone mentioned that earlier about food retail. There's tons of tools that are being used right now and being developed. What are some common ones we can use and share across here in this community?
I can't speak to what's on the ground because I'm not a practitioner. I can sort of speak more to kind of the landscape and comparative. One thing that I'm saying, there are neighborhoods that have lots of things going on, or schools that have lots of things going on, and those that don't. I'm never quite sure if the unmet needs are being met, and those needs that are being met, are they being met in the highest impact possible ways? And to use the example that Kathy gave, for example, Teachers College did a study of nutrition education programs across elementary schools across the city, and 39% had outside nutrition education programs of some sort or another, and some of them were multiple programs. And it's just a sample, but you then wonder about the other, 61%. Was my math right? Something like that. And you want to look at the distribution. Are they in the schools of the greatest need? How are they fitting with other objectives? So one is the sort of where services are being delivered and where they're not. Two is, one of the things I see is sort of not just what's happening at the same time, but what happens sequentially over time, because if you look at many of the programs that we're involved in, some of them have been in place 5 years, 10 years, often prior to the data that exists. So a lot of organizations that we work with that, as they do, let's say, community food assessments or something of that nature, as we were dealing with them in 2009, they were dealing with 2000 census data. And if we, get a needs assessment in 2014, they're dealing with the community health profiles that the DOH did in 2006. And so none of those sort of accommodate an understanding of what has changed, what's gotten better, what perhaps hasn't gotten better. And so that when people are sort of proposing different projects, I can't tell sort of, are they advancing, what's been done, and in the positive way, and fortunately we'll speak to this very quickly because we don't want to sound like, dire situations, but, one of the questions is sort of what's the additive value of different programs? So we're talking in many ways around both environmental and cultural changes, and those require saturation. And so I would not say, oh, it's such a problem that everyone is doing things, but again, are they connected over time and then laterally? Neighborhoods that, you would have, if you lived in or worked in or visited, 8-10 years ago, had very few options. Now you walk through parts of Bed-Stuy or the South Bronx or East Harlem, which some of the ones where we're saying there's a lot going on, but you see a lot. I mean, you'll walk past a couple of green cars. You'll walk past, bodegas that have shop healthy signs in the window. You'll walk by a school and this is going on there. You walk by 3 community gardens. I wouldn't say those are necessarily problems if they know that, they're somehow woven together, because we are talking about changes in the food landscape.